thank you for keeping your videos on, because if you keep your videos on, that's good for the recording. Then the recording doesn't show just names, but it shows people with their faces, which is always good. Thank you, Anusha. And I think Tisha, who's my colleague helping me today, I will request Tisha to start showing the Catalyst 2030 video in a minute. For those of you who have, or do you think my co-panelists, do you think we should wait another 2 minutes?
Yes.
Yes, maybe. Yeah.
Yes.
We can wait for 2 minutes. Yeah.
Hi, Deep. This is Beena.
Hi, Beena. I was actually trying to look at the screen as to who was the person on the screen. How are you?
Good, good, Deep.
Good,
And
good.
you?
I'm doing fine. Weather is, we are having a lot of rains, that's all.
Hyderabad, I mean, no rain.
Oh. It's because of the cyclone thing, but it should be raining in Andhra Pradesh or Telangana also.
Yes,
No,
Andhra.
but apparently these rains are not from the cyclonic depression. This is local clouds.
Okay.
That's what the papers are saying. I should do something. So maybe I think just say a few words about Catalyst 2030. The video will tell you more. So Catalyst 2030 is a global platform of social entrepreneurs, and there are people from other sectors as well. This has been, it's almost a spontaneous platform of social entrepreneurs and activists that was formed to ensure that the SDGs actually get achieved by 2030 and not by 2080s, as the current rate would mean. Welcome, Ed. Welcome everyone who's here already. And I would request Trisha. Hi, Ed. How are you? Thank you for being here.
Delighted to be here. Thanks for hosting.
So, Tisha, can we have the Catalyst video, please?
Shall I show Paramita Di?
I have the video up, so I can share it for you now if you'd like.
Yeah, Melissa, that will be great.
Perfect.
Welcome everybody here.
Catalyst 2030 is a movement of social entrepreneurs and innovators embracing collective action to achieve the SDGs by the deadline 2030. Our 1,500 members are active in 197 countries. By emphasizing collaborations, Catalyst 2030 is leveraging the power of the collective to accelerate real change in the lives of billions of people around the globe. What do our members say about Catalyst?
Catalyst 2030 is an invaluable global community of impact entrepreneurs.
Our relationship with Catalyst 2030 has really taught us the power of co-creation.
Join Catalyst 2030 and network bond and collaborate with our family members. And I like the spirit of bringing change makers together to share and learn from each other.
Catalyst really understands the transformative nature of collaboration.
It's also a platform that can give us new tools and resources.
Catalyst 2030 has put my work on steroids.
But most importantly, to come up with solutions that are practical, ways where we can really make things happen, because social entrepreneurs are doers.
Are you a catalyst? Join us to achieve the SDGs.
Thank you, Melissa. And I am requesting everyone to keep their videos on. But as you can see, I have turned my video off because, okay, if you can hear me, I'll just try it with my video on once more. So thank you for joining us here today. We are very excited to have you with us. Just 2 words about Diksha. Diksha is an organization working to change the ecosystem that denies agency to young people. We believe that young people should have a say in things affecting their lives. And unfortunately, working in India, we work in a culture, in a socioeconomic situation, which is exactly opposite. Young people are forever being told not to talk back to adults. They're forever being advised that adults know best. So that's the ecosystem we challenge. So as far as SDGs are concerned, we at Diksha felt very strongly that unless we are ready to listen to teenagers, we cannot re-energize the SDGs. We have to involve them, and to involve them, we have to listen to them. So this is just a pilot initiative that we have started. It's we are focused on 4 SDGs in this report. 3, that is good health and well-being. 4, that is quality education. 5, that's gender equality. And 10, that's reduced inequalities. The reason we chose these 4 is because we at Diksha work with a focus on these 4. However, as far as asking the young people about which of the SDGs they consider most important, we shared the entire list of 17. At the moment, it's only at pilot stage. We have only spoken to 80 children in the age group of 13 to 18. And there's a clear, it's a very simple survey of 55 multiple choice questions. These 80 young adults, we have an exact 50% divide between the urban and the rural, 40 urban children, 40 rural children, of course, within West Bengal only at the pilot stage. But we do hope that after today, these responses are able to excite all of you enough to take it up and really create a report that is national and global. That's the ambition. So with that, I will just like you to see the gender divide. Of course, we had more girls responding than boys. 21 boys, if I'm not mistaken, and the rest are girls among the 80. Now, we will start with good health and well-being, and I'll invite my co-panelists to talk about that. You know, among the 80 respondents we have, the good thing is that a majority of them go to either the community health center, the government-run community health center, or the nearest government hospital when they need medical intervention. But 31% of them still seek treatment from the local medicine shop. That we believe is some cause for concern, and I'm flagging this for my co-panelists to reflect on. And the second thing, among COVID stressors, the 2 things that emerge to be the most, to have had the most adverse effect are reduced family income and adverse impact on education because of schools being shut for nearly 2 years, more than 2 years for younger ones. So this is another point that we could reflect on. Interestingly enough, this is a point where I believe that civil society organizations like us might have something to think on. This percentage of, can we go to the other slide, please? On good health and well-being, Tisha. I'm sorry, good health and well-being. Anyway, so if you notice, only among 80 respondents, 29% of them have no access to any mental health support. And though it is not mentioned here, I would like to mention that most of them are boys. The second, what I said is probably a cause for concern for civil society organizations like many of us here, because only 4% of respondents mentioned that they go to a CSO counselor for mental health support. Of course, the entire rural 40 respondents have no access to any civil society organization. But among the other 40 in urban areas, they're all attached to some CSO or the other. Even then, only 4% of them seek the CSO counselor's help. That, I think, needs some thinking on our part. And mothers emerged to be the most popular figure to offer mental health support, not just to girls, but also to boys, though mostly to girls. Now, here is probably a strategy pointer for us. How do we then work with mothers to enable them to be better, to offer better mental health support to their children? Yeah, with that, Shohini, would you like to reflect on these, please?
Yeah, so thank you. So yes, definitely, like, Kolkata Shangbed used a very innovative model, like using dance and dance movement therapy to focus on the mental health and well-being, and mostly with the young population and also adolescent population. And what you were saying, yes, it is right, because most of the time the challenges is that one is there is no awareness that mental health awareness is very important, because sometimes we thought that if I have to access mental health, I have to be a mental health illness or some disorder or something else. But without that, also mental health is important for general well-being and lead a life. I think that awareness is missing. And mostly for adolescent and the youth, it is a kind of a growing age where they really face, because they come with a lot of new ideas, their body hormone changes, and also they face a lot of anxiety and emotional distress with a lot of issues, because they receive a lot of information, they get different information from the family, different information from the society, different information from their peers. So they are also confused, but they do not have any space to go back where people can listen to them. So I think one is that promoting positive mental health to, strengthen them, and building a resilient community with healthy coping mechanism is a kind of a big part where we are working, and also reaching out to youth, because they most of the time their critical part, they felt that they are not heard. So whatever they are saying, so creating a space for listening to them, I think also a mental health space where a lot of things can come up. So that's why when we use the dance, and because we use art, all the art-based intervention, and it has a very powerful area of expression, the way I want to express. So I can express my anger, I can express my all emotional distress, I can express my frustration, I can express my joy, I can express my pleasure, I can express my lot of things, because sometimes when also we talk about mental health or therapy, we only see the negative part, but also bringing the positive part like the joy, happiness, hope, strength. That's also part of mental health. That's also part of health and well-being. So like maybe I can, as of now, I can end here, that if we can really create a space for young people where they can freely express. So when we are talking about health and well-being, so that they can talk about their sexual health, they can talk about their, any kind of health, physical health, emotional health, cognitive health, social health. So all the issues can come up, so that free expressive space is very important for an youth to look to really develop a well-being space. I think I can, Paramita Di, passing to you, or Deep, if you can reflect from here.
Thank you so much, Shoini. Actually, Deep, I'll wait for you to speak later. I want to invite Pauline at this point. Because you have global experience, you have experience beyond. I would really like you to reflect on, is the situation, this entire point of, lack of awareness about mental health and the entire taboo against needing any kind of mental health support, and the disability to recognize psychosocial.
Paramita, we're losing you a little bit, but I think I got the question.
Global.
Yes, thank you so much, Paramita. I hope you can all hear me well. And thank you for inviting me to talk at that point, because as a matter of fact, and especially through our work that we do with Learning Planet, which is a global community of stakeholders in the educational space, especially through Learning Planet and our work with the youth at Learning Planet through our Youth Empowerment Circle and the Youth Fellows that we have launched in the past few months. Mental health has been, and should, as it should be, the primary priority topic that we are talking about with and by and for the youth themselves, because it's the base of everything else that you can do from there. Thank you so much, Paramita, for showing this study, which I think is very, very important, directly taking inputs from the youth and understanding, again, just like a lot of other things, that unfortunately the services and the opportunities in terms of mental health to the youth are not accessible to the ones that need it the most. And unfortunately, it is something that we can say about a lot of things. The most vulnerable, the ones that would need more attention in terms of mental health, are the ones who have the least access to these spaces that Shohini was talking about, right? So this is a complete paradox that we are seeing all over the world. I'm not only talking about India, where where I sit now. I live in Kolkata for the past 4 years, but I'm also talking about France, where I come from, and other countries. For now, we're still at a stage where we have not succeeded in institutionalizing these spaces for dialogue, right? It's important to have, as Paramita was saying, civil society organizations that are opening up these pockets of dialogue, but are we doing enough? It has to be institutionalized. It has to be systematized, especially through the institutions that are already in place. If we talk about the youth, adolescents, and young students and kids, let's tackle the school system, for example. Is it there at school? And again, Paramita, maybe that's a transition towards your next slide. You're gonna, focus on quality education next. In school, where this is supposed to be a space for dialogue and learning, mental health spaces or expressing yourself free, we don't need to put the mental health verbatim, right? To understand that this is only spaces where youth can express themselves. Even that is not in place systematically in all schools in a lot of countries around the world. So I'm sure we'll get to solutions and to more hopeful comments later in the, in the session. But for now, I really want to stress on the cruciality and the essence of mental health as a priority before any youth can actually develop from there, right? That's the priority number one. So thank you, Paramita, for putting that priority onto the agenda today.
Yeah, and I just wanted to add one thing, Paramita, quickly, that also when we work on these mental health issues using this creative intervention, so one thing is very important we found, that is culturally contextualized word. That's Paramita said. So we are piloting a very small, things that building community well-being center. So currently we are piloting this, and it's really going very and running by the youth. But then we came out with a word like kind of ghore by, like I'm saying the Bengali, maybe Paramita you can translate, and it's really worked well. The 120 young, a group is working on this. It's like ghore baire bhalo thakbo bhalo rakhbo. So if you can just, Paramita, is it possible for translate to you this word? So it's really helped them to also, building this awareness, not only among the youth or they taking the ownership, but also in the family and the community to understand that exactly what is, the well-being, rather talking about only the word which they feel also very disconnected, that this is not our thing. So that's I like find in the work that culturally contextualized model and work and initiative also required in this intervention.
Thank you, Shoini. I know we are concentrating too much on mental health, and we need to. So I'm not too bothered about that. I'll invite Deep to reflect on this, and also how it is connected to the whole question of denying agency to young people. Because I know, and I want Deep particularly to bring in his reflections on boys, because Prajuk works with a special focus on boys in difficult situations. So, agency, mental health, positive from you on this. Please connect it with the agency question. And for all our participants, you can either post your questions in the chat box, or we will try and take questions at the end. We do have intentions to keep about 7-10 minutes in the end for question and answer, but you can certainly put them in here as if you think so. Over to you, Deep. Thank you.
Thank you. Just a little bit of an introduction to Prajuk. Well, we work with adolescents, largely focuses on children and adolescents, but we work with adolescents and other young adults. And our work is at the cusp of both gender equity and child protection. So when we are looking at child protection, we are looking at it through an approach which is gender transformational. Part of it is that we work with a specific focus on boys and masculinities. Trying to answer the question that that has been asked to me, let me talk about how we look at agency and how we work with agency. So we would like to talk about both individual agency and collective agency. So our work has shown that when we are looking at challenging gender norms with among young people, the easier things that it is possible for young people to do is to challenge these gender norms. It is easy inside their families. It is not so easy in the communities. But in being able to challenge gender norms within the families, I think that contributes to agency in the sense that the other, generational difference or disempowerment that happens, because age is often, as you know, is an axis of power, is that they have often been able to exercise their agency in the sense that they have been able to participate in family decisions where otherwise they would have been left out. So I wanted to talk about this very fact that, that when we are talking about agency, we need also at the same time to look at how at the family level, agency can be expressed. The other thing where I want to link it to a mental health is when we come to collective agency. So when you have individuals who have changed, individuals who are trying to challenge existing perspectives within their families, when they're getting together, trying to build communities, which Shohini was talking about, Pauline was talking about, build communities which are responsive to their needs. Often what happens is that the experience is that, I evolve, I get a very different perspective, but then I start losing my friends. And I'm talking about this also from the perspective of young boys who can identify the privilege that patriarchy gives them, the privilege that patriarchy gives them in the family and communities. And when they are challenging patriarchy, when they are trying to transform themselves, there is often this very strong feeling of isolation because their existing friendship networks just get disrupted. They are often stigmatized as feminine boys because they are now standing up in a sense for what women have to do. And this is a very, very strong isolation thing, which almost pushes a lot of young men to give up what they are trying to do. And that is where mental health services, I want to therefore identify mental health services as part of collectivization, as part of gender transformation within the families and communities, where this sense of isolation is something that a lot of boys require support from. So that is one thing that I have to really talk about mental health, since we are on this issue. So Paramita Di, so far, this is what I have to say.
I'm muted. I'm speaking while muted. Yeah. Thank you, Deep. We will, Melissa, would you want to comment on this entire mental health scenario from the Catalyst perspective or from your own experience? Would you like to come in with your observations, please?
I'm not sure if I'm best placed to speak of this at all. I don't know if Matt, if you have any comments. He's also from the Catalyst team. I think, yeah, I'm happy to leave it with the panelists.
I think we're here to observe. Yeah.
Over to you again, Paramita, I think.
Paramita Di, are you here?
Yeah, I'm very much here. Okay. Matthew, did you want to say something? I couldn't get what you said clearly. So would you want to say something? I'm asking Matthew, yeah.
No, Paramita, we're just here to observe. So okay, back to you. Thank you.
Fine, then I will request Tisha to, this is of course a huge issue that we will have to continue talking about, continue taking initiatives to address, but let's now go to the quality education. Now look at this, I use this as part of the poster, is that, yes, it's a good thing that school enrollment, at least in the state where we collected the data from in India, has hugely increased. Only 6, that's only 8% of the respondents, have dropped out. They're not going to school to the 4 hours, which is really good. However, we have a law against corporal punishment in school, by the way, but 58 of the 80 respondents, which is more than 72%, mentioned that they face corporal punishment at school. And please note that only 21 of the respondents were boys, so which means that corporal punishment is not restricted to boys' schools only, girls too face corporal punishment. Now we're talking about teenagers, puberty, which is when we believe that life skills education and sexual and reproductive health and rights information is extremely important. Tisha, can you show us the slide where they have responded about whether they receive any information on life skills education and SRHR from schools, which I believe is the, our schools hardly offer any information on life skills education or sexual and reproductive health and rights information. Now, this is where you will notice that this is where civil society organizations play a big role, because 31 of the respondents mentioned that they get life skills education from CSOs they're attached with. 39 of them mentioned that they get information from CSOs they are attached with. And please note that as many as 49 respondents mentioned that they have no source of life skills education because they have to any civil society organization. Now, this is probably, it's interesting that 28 of the girls, of the rural girls, mentioned that they receive SRHR information from the ASHA, Accredited Social Health Associates. They are socially situated health workers, women from villages who work as ASHA. It's a government scheme, central government scheme in India. So 28 of the rural girls mentioned receiving some SRHR information from ASHAs, but not LSE. Now, this is another area that we have to seriously think about when we are speaking about quality education, because in our understanding, quality education for teenagers must include life skills education and sexual and reproductive health and rights information. Any thoughts on that? Maybe we start with Pauline right now.
Thanks, Paramita. One thought that just has come to my mind is, and I think this is going to be related to further thoughts in the discussion, but it's when I was going through your presentation, is that it's crazy that the youth is not part of the design of their own education and what they need to be taught and what they want to learn about, right? Because they are going through life just the way everybody does, and the essential life skills and sexual and reproductive health skills and knowledge is at the base of what we should first need to know about before all of the theoretical knowledge that usual and unfortunately traditional educational programs and curricula are offering nowadays, right? So I don't want to say much more than this, because this is one of the core conclusions of your PowerPoint, but if we were to listen to the youth more, that would come as such an obvious thing to do, to be able to tackle these, life-related skills and topics, that probably talking to the youth and taking their point of view into account at the school level and at any organizational level for that matter, would allow us collectively to design programs and projects and initiatives in a much more relevant manner. So here indeed, and I was also very, very surprised by the corporal punishment figure that you showed, which definitely shows this kind of unfortunate power balance between what is done by the adults and what is being suffered from by the children, which obviously do not have a voice to re-establish a balanced and fair situation. Thank you again, Paramita, for this second very important topic, that is quality education.
Thanks so much, Pauline. Shoini, since Kolkata Shombe works actively on disseminating SRHR information to adolescent girls in particular, Would you like to reflect on that a little? And I would also then invite Deep to come in on the importance of the same life skills education and SRHR information for boys, and how that is connected with a complete lack of any governmental mechanism to what CSOs have been saying for years now. Just as what Pauline said right now, that it's incredible that young people have hardly any say in what they want to learn, what they want information on. And it's not the first time that this is being discussed. Civil society organizations have been flagging this issue that, create mechanisms for young voices to be taken into consideration in determining policy and programs, but we still don't have any mechanism, official systemic mechanism for doing that. So after Shohini, if we could please come in both on the importance of these two kinds of education for boys, and this whole question of a governmental mechanism to bring that in. Yeah, thank you. Over to you, Shohini, first, and then to Deep.
Yeah, thank you, Paramita-di, because this, this survey and the research report is very, very helpful, and the data is really, kind of a eye opener. And definitely, SRHR, when, we started to talk long time, I think, like we all civil society organizations feel about this importance of this SRHR education, because without that lack of information is make people also handicapped. Like that is also like lack of information and the education on sexual reproductive health and rights also put the young people in more risk. But when you like what I was feeling when observing your data, that it's so important. A long time back when we went a lot of schools, especially in government schools also, but we did not get any, space to enter, because one of the, like most of the schools change, if you can change the name, like SRHR name, so they cannot say sexual reproductive health and rights. And also one thing I was thinking that, taking this report also as a strategy or as a kind of a policy to present it in front of the teacher or the government, bodies, that this is the situation and the data is coming from youth. And we can see that, the vulnerability, especially when we work with the young girls on their sexual reproductive health system, like the pregnancy and their life risk, and under this child marriage, or most importantly, youth and the young people have full rights to have this knowledge, whether we understand this. I think that is very important. Like it's my body, my sexual health, my sexual rights, and I think through this sexual reproductive health and rights education, the knowledge of my sexual health rights is very, very important. And entire young population, like that, like we are excluding them from this. So I think that when I talk about I'm not talking about only civil society organization. I'm talking about that entire, society, that how we are excluding them from the knowledge, education, and their rights. So I just wanted to, stop here, and I pass from here to Deep. Deep, you can maybe articulate much better.
So much. Thank you so much, Shohini. Over to you, Deep.
Okay, actually lots to say in this. Let me start with the basic, conflict that a lot of CSOs who work with child rights and the government, at least in the Indian context, faces. this is a conflict between a custodial approach to children's rights, a custodial approach to rights, which includes participation. So it's a custodial approach to participation in the sense that all participation has to be guided. We are adults, we are custodians, we know better, and so we will even guide your participation versus what we are talking about agency. Now, I want to bring out a very specific thing. I want to reiterate what Pauline said, is that all this is very fine. You know, CSOs are trying to create small forums for young people to talk about this. Some of us are actually taking these recommendations and trying to lobby with the government and with international agencies. All that is fine. But if we do not have an institutionalized infrastructure on which governments at different levels and international agencies and CSOs like ours will be forced to listen to what they are saying, what children are saying, and respond to that, we can just go on about agency, but nothing really will happen if there is nothing that is institutionalized and if nothing that is mandated. I know it's a big demand, big ask, but this is what is the call for the day. And in trying to talk about agency, let me talk about a little bit about language that Shohini was talking about. We have to keep in mind that language is based on the culture of a particular group of people who speak that language, and these cultural histories have been different. The way English language categorizes things or names emotions, names different concepts is not the way, say, the language that I speak in Bangla or in other Indian languages often do it. And what happens for a lot of CSO workers is when we try to translate, quote unquote, these concepts which are in international charters into concepts which are in India. For example, I'll let you know, the word child is often translated by a particular word in Bangla or in other languages in India, which is considered culturally to be human beings who are maximum up to the age of 11 or 12. So the moment the word child is translated into our indigenous languages, and we are actually talking about adolescence, there is huge pushback about that, huge pushback from communities, from families about this. So one very, very important thing is that also the language in which young people will exercise their agency, because we ourselves as CSO workers are often at the front of this language translation politics. How some sort of translation actually changes the cultural meaning of what it wants to say, and it creates a lot of confusion. And that is where a lot of our laws, which do not really reflect indigenous categories of thought, actually creates a lot of confusion in the communities on the ground and in interpretation, because you have one thing written in English and the other thing that you actually interpret and implement on the ground. So this is very important that this double bind that we find ourselves in, I think for young people, this is an even stronger, bigger challenge. And there has to be a language which children themselves and young people themselves understand. For example, a recent conversation with a young person, and that person was not using the word toxic masculinity at all. He was not using the translation, the direct literal translation of toxic masculinity. He kept on telling me a word in Bangla which means oti purushatva, which translated in English would mean extreme masculinity. Now, this is a word in Bengali which is very easily understandable in the sense of toxic masculinity. But so we need to really have a language in which children will exercise their agency within their cultural context. So that is something that I want to talk about, especially in the education sector. Corporal punishment and other things, I would really love it to know what the breakup of that, the gender breakup of that would be like. Corporal punishment is something which a lot of teachers say that, there is no corporal punishment in India, but you have this continuous, feedback coming from data from young people that such a thing is happening. Quite shameful for a lot of us, including in the CSOs who have been working on this for a long time, working with teachers, that this still continues to happen. But again, as I say, when I talk about, trying to look at, indigenous ways of thoughts and cultures, is that this is again a place where mental health comes in, not only for young people, but also for parents. Because the cultural thing is that, which everybody knows, which happens even in domestic violence, is that parents sometimes beat up children, teachers sometimes beat up children because they care for them. And that is settled inside the minds of both young people, children, and their parents and teachers. I have had a lot of parents telling me on the ground that, I asked the teacher to beat the child up, but the teacher doesn't do it. So it's, the parents are frustrated that, teacher doesn't beat somebody up. I think this is very important for us to also look at from a cultural angle as how we can actually reduce violence, how we can actually challenge these thoughts, but maybe through a different sort of language. The other thing is also that when we're talking about listening, when children are talking about mothers as, a very, very big category of mothers whom they go to for, psychosocial support, people are talking about ASHA for SRHR. I was actually, it would be very nice if I got to know whether it is more boys or girls or it's like neutral. Then I could have said something more, much more. But I think the children are actually telling us from where they want to access information. So instead of just focusing, for a lot of child rights organizations keep focusing on just good parenting, but good parenting around what? So are the parents being, especially the mothers, are we working to build their capacities to talk to children also about SRHR things in particular languages, or we are just looking at, limiting itself to just, corporal punishment, don't scold the child, listen to the child, etc. So I think that's something very important. Also, where I think there is scope for ASHA workers, these government health workers, if they are the major information for SRHR for a lot of young people, is it time to really relook at, the system in which they work with? Can we have more such workers? Can they be asked to have more time to actually talk to young people in groups? So these are also other things that is coming in, because children are saying, young people are saying that maybe Asha, we are comfortable with, these health workers. Thank you for now, Paramita.
Unmute.
Thank you, Deep, for your very important reflections. Now, we do want to keep some time for question and answer. So very quickly, on another extremely important aspect, gender equality. Tisha, can we see their reflections on we will present that on the screen. Now, interestingly enough, most of our 80 respondents were very clear that boys and girls are not treated equally. 72 among the 80, which means even boys recognize this difference. Boys get more freedom, benefits, and privileges than girls. Again, 70 of the 80 respondents said yes, that again, boys are fully aware of this differentiation. At a certain age, young men are expected to earn and women are expected to get married. Present more kind of mixed scenario. Look at it, only 51 of the 80 respondents agreed to this. 29 of them, only 29 of the respondents said yes to this. 51 of them said no. So maybe because the respondents we have spoken to are in the age group of 13 to 18. When these figures change, when we go, farther into other communities and other situations. Look at the next. Freely, chances of getting raped increase. 51 of our 80 respondents, girls and boys together, that is, said yes. So that is the situation in which we are bringing up our teenagers. But they're conscious, only they take care of 35 of them said, no, this is not true. Look at about other forms of inequalities. Poor families, children get the same opportunity. 77 of them said, no, that's not true. And religion and caste-based discrimination is prevalent. 58 of our respondents said, yes, that kind of discrimination is prevalent. So if we can go to some of my colleagues are saying that I'm not audible. Am I audible to the rest of you, please? Can you hear me?
Now we can hear you.
I'll turn off my.
I could hear you. I could hear you all along.
Okay, okay. Thank you, thank you. Can we go to the next slide, please? Teenagers, look at that. So they are aware of these situations, but they also have their thoughts very, very clear. Boys and girls should be treated equally. 75 of them said yes. It's okay for boys to get more freedom and privileges than girls. 65 of them said no. I'm stressing these figures because it means that not only the girls, boys have also said that these situations are not okay. Same thing about the next one. It's fine that young men are expected to earn and women are expected to get married at a certain age. Look at the confusion here. Only 28 of them responded. The others didn't. So they are confused about this. But about religious and caste-based discrimination continuing, 58 of them very definitely said, no, that's not good. And it's natural that chances of, if it's okay, whether it's okay. This is another one that I would like to draw your attention on, 35 and 16. So 35 of them think that this is not okay. It is the situation, but that's not okay. But 16 of them said, it's fine, it'll always be like that. Interestingly, it doesn't reflect here, but all 16 were boys. The 16 were among the 21. I noticed that, so thought I will just share that. Yeah, so with that, quick round of reflections from each one of you. From your, start with you, and everyone else, if you have questions, please start putting them in the chat box. So can we go in this order right now? Pauline, Deep, and then Shohini. Thank you. We have 7 minutes left. So maybe a minute and a half or so.
Okay, so we're finishing at 3 p.m. Paramita?
Yes, that's the time we have.
Okay, so I'm going to take that opportunity to say a few, to give a few messages that I haven't had the opportunity to. So, to me, what remains very strong in your presentation in these slides is the last one. Teenagers know what is right. So this creates there's a couple of conclusions that you can draw from that. The first one is they know what's right, and they see that the world around them does not reflect what they think should be right? So there's this cognitive dissonance of, we know that ideally the world should be like this, but it is like this, which creates a lot of confusion and a lot of the mental health issues that we discussed previously in the call. One of the key topics that I just wanted to mention here is this term that most of you must have heard, which is eco-anxiety. That is the youth, the young generations that have been born and raised and grow up into that world that is environmentally and climatically, problematic and challenging, and do not understand, where that comes from and how, and the kind of inaction from all of the other generations on that particular topic. So the fact that they are very aware of what should be right, as Shohini said, gives them the right to be part of that conversation and to take a leadership role into the conversation. Just a quick story. I remember when I was a student and I was working on a case for Pernod Ricard. You will see the connection very soon. Pernod Ricard was actually wanting some help and advisory about how to make sure that they were more gender inclusive, and especially at their board level and management level. And one of the key arguments for this transformation to happen is that if there's not enough women in the management roles, in the leadership roles at the level of the company, then it is not representative of the consumer, of the consumers, the consumer base of that particular business. In the very same way, I want to propose something today of, you know, seeing, and I think we would all agree on that on around the table here, but I want to try to put words on it. Not seeing youth inclusion just for the sake of inclusiveness, but for the sake of relevance and accuracy and representativity into what we're saying, into what we're doing. It is not normal that for specific political rights or needs or collective decisions, there is this huge part of the population that is the under 18, under 25 years old that are absolutely not part of the conversation, which is why in France, we see more and more conversations and more initiatives actually including, you know, for example, talking about the voting rights, bringing 18 years old, the 18 years old cap a bit younger, because, you know, why would we completely excuse that voice? And so Paramita, you asked me a couple of examples about organizations that institutionalized including the youth voices into their operations and activities. Just to mention a few, you have AIM Mentoring, which is an organization based in Australia, which has this co-CEO model where any one of their managers is actually, shadowed and advised and followed by a youth. You have the working group Jouzel in France, which is basically between the Ministry of Education and Youth that are consulted on how to include sustainability into education programs. In the previous, presidential election in France, you had quite a lot of debates on TV, on formal communication channels that kind of welcomed dialogues between youth and presidential candidates. That was really interesting as well. You have the Youth Inclusion Network, which is an initiative of the French NGO Life Project for Youth, and so on and so forth. So you see organizations taking the leadership of youth inclusion, but as we discussed earlier, it's really a call for institutionalizing it through all of the businesses, political bodies, schools, and so on and so forth that we can think of, that I would want to finish on. Thank you, Paramita, for the space to speak today.
Thanks so much. Show any quick words, and Deep, you could end.
Yeah, so I just wanted to very quickly say that, our starting point of the work is with the body, and also it's for any gender, so using dance and dance movement therapy to just challenge gender binaries to create a gender just world. So, create a voice, create an expression, create the liberation from the body, because most of the time, even I say, like, as the girls also constantly restricted by the society to express themselves, as well as, it's for young men and boys, like they are unable to express their emotion, they're unable to express what's happening into their body. So I think like and I'm saying from the beginning that if we can create that space where they can fully, and I'm really, pressing, they can fully express themselves, feel like without any judgment, without any fear, without any taboo, and we can really, have a dialogue and create more dialogue on this. So even today, if you ask me, I am missing those voices, because still we are talking about on behalf of them. So it's very, very important bringing those voices even into the table. But thank you, Paramita Di, you brought that voice, in a different way here. Through that research and all, but I always feel that it's very important to listen to them and co-create that space for that freely and fully people can express.
Okay, just two quick things. One is, again, I think we really need to look at how the youth voice on SDGs, whether through a report or etc., can be brought out, how many more people can join in this, because I think none of the SDGs, when they're talking about it or reports by adults, actually even mention the fact that there should be, what I'm talking about the second time, is an institutionalization through which children can exercise agency and their voices can be heard. So these two things, one is the report and institutionalization as a big demand.
Thank you, Deep. And we are already 1 minute over time, I think. Are there any pressing questions? Otherwise, we will formally close this session, but we do hope that this will really become a movement to generate, the People's Report by Catalyst 2030 was a success at one level. We did hear some last mile community voices at global forums. So can we do that for the young people? They also want to be heard and they have a right to be heard. On that note, a big thank you to the Catalyst team for their support, for even providing us the Zoom platform, because Diksha doesn't have any. Thanks a lot. Thank you, everyone. And bye. This is for Catalyst. Thank you. Thank you all. Thank you to my team for their support as well. Bye then. Yeah, we've noticed this, Melissa, Tech Action. Thank you.
Thank you,
Bye, everyone.
Thank you so much, everybody. Take care.
Thank you.